Welcome back to the show. So it's a somewhat uncomfortable topic, but if you're a parent of a school-age child, your household could be at risk. We are talking about lice.
Pediatrician with UT Physicians and assistant professor for McGovern Medical School. We have Dr. Kenya Parks, who's joining us now with more information. Welcome to the show.
Well, thank you for having me.
You know, this is such an interesting topic. When we were talking about this in our meeting about head lice, it seems like it's one of those things that we should talk about, but nobody really wants to talk about it.
Exactly.
What are some of the myths? Or actually, let's just talk about head lice. What exactly is it? How do we get it?
So it's a small insect that is really spread by close contact. And it's usually like in children, those are the age groups, like the school-age children, and they hug each other, hair-to-hair contact, and that's the way it's usually passed. There's a small percentage that's also passed, like maybe by pillowcases, hats, and other things like that.
Oh, wow. And they look pretty gnarly. We're seeing a close-up version on our screen now. They actually feed on human blood, right? A couple times a day. So it sounds really disgusting. But it is something not just kids can get, adults can get it too, right?
Adults can get it, but the primary targets will be children, probably because they have like a lot more close contacts with multiple other children.
Do we have the source, like where it's coming from or how a child can get it?
So it's passed by contact, and so it only takes one child to have contact with multiple other children, and it's passed throughout the school. And then sometimes it's a little difficult to get rid of, so that child could be like a vector for multiple other children in the school getting the, or school friends or individuals in the neighborhood.
Now, a louse or lice collectively, they just crawl, right? They can't hop, they can't fly.
They cannot hop, they cannot crawl, fly. They can be left on like strands of hair, so that another method would be maybe when a child is being blown dry and that could be passed in that way maybe, but for the most part it's really close contact. Sharing a bed, school friends that just hugging each other, that may be probably the most probable way that the children would get it.
Okay, so, and as Courtney mentioned earlier, there are a lot of myths. I mean, people assume like, oh, someone must be unclean if they have lice. Totally false, right?
Totally false. That's a total myth. All socioeconomic backgrounds, all different countries throughout the world, so it doesn't really have anything to do with hygiene.
And this is really interesting. An estimated 6 to 12 million infestations occur each year in the U.S. among children 3 to 11 years old. So this happens.
It does.
It does happen. We've talked about what they are, how they live. Now, how do we get rid of them, doctor?
So actually, a lot of the over-the-counter medications like Rid and Nix are pretty effective. What people don't know is the proper way to use them. So the important thing is not to use like conditioners when you're applying them, because it blocks the effectivity of the medication, and also to reapply within about 9 days. So, and doing that combination and maybe also using the combs, what actually is pretty effective. So if that doesn't work, definitely go to your pediatrician, physician, and they could recommend some prescribed medications that are also pretty effective. But really, the first-line medications are effective if used properly.
Well, and key here, doctor, is not just about getting a louse or the live lice that are in someone's hair, but the eggs, they adhere to the hair shaft, right? And so that can be one of the problems with like a reinfection, right? Because if you don't get all those eggs out, they can hatch and you can have
and what a lot of people see is actually the empty casing. So a lot of people look at that and say, oh my goodness, there's such an infestation. But a lot of times they already are.
They've hatched.
They've hatched. And those are the more visible. The ones that are actually alive, they sort of camouflage themselves and you can't see them as well.
Yeah. Oh, don't mind little Tex. He's just sniffing at your feet there. Totally normal. Okay, and as Courtney mentioned, if it is, I mean, you said that there are some places that you can go to, like the Lice Ranger.
Right. So I would recommend just using the over-the-counters first, and if that doesn't work, go to your physician. If you wanna, they do all the work for you, but they could be a bit pricey, and when you could really cut the cost by just using over-the-counters, which are not so pricey. But sometimes parents opt for that, especially if they have like multiple children that are infested, and it's like, I want to get rid of them. So definitely, I understand.
Let's bust some of the myths, if they are even myths out there. I've heard like using tea tree oil or a spray is a good deterrent for lice.
So there are no studies, but they are mentioned you could try it and it wouldn't hurt, but there's no studies that actually prove that these work. There currently some methods are being studied, and to include tea tree oil, and they have like a couple others that are sort of natural methods of getting rid of them, but none of them have up to this date been actually proven by a scientific study.
All right, well, Dr. Kenya Marie Parks, thank you so much for stopping by. There's some info on your screen right there, utphysicians.com.
That's right. For more information, to schedule an appointment with Dr. Parks or any other pediatrician, you could do so